Well, I appreciate everyone that's stayed around for this. I'll try and keep it short as possible. Um, Spare you a lot of the numbers, but what I'd like to do is share just some of the background on a study that we did and how it pertains to the new center we're launching, the Center for, or I should say, the Maternal and Early Childhood Health Center for Policy and Practice in Heartland State. So it basically makes the economic case for investing in maternal health. We look at the human impacts in terms of poor maternal health outcomes, infant outcomes as well, and how they translate into lost human capital and lost economic opportunity. Most people would not understand that the US ranks 11th and 12th in maternal and infant death rates, respectively, out of 15 nations with a GDP above a trillion. Think about that. 11th and 12th. Uh, if you look at in terms of just preterm birth, the US ranks 13th. And if you look at, well, preterm births, you average all these out, maternal health outcomes, the US falls behind uh, Brazil, Mexico, and Russia. And when you look at US heartland states, they literally are third world countries in terms of outcomes relating to maternal and infant health. It's really just a disgrace. So we've been working in this space. We focused on principally three states, but Arkansas was among them, and Louisiana, um, Mississippi, and Ohio as well, just to kind of benchmark things. So the study really goes through a lot of different factors. I won't go into all of them. I'll just give you the summary version of it. So we're basically looking at the impact of moms on the current workforce in the future, how that translates into lost economic opportunity and poor workforce development. It also relates to low labor force participation rates among women. So a lot of factors. Um, and we look at both medical and non-medical costs in doing so. And there's considerable cost disparities between a healthy and undesirable outcome for maternal health. And I'll show you those in just a few minutes. And also looking at some of the underlying factors related to this. And this gets into the social determinants of health and rising rates of chronic disease. Um, so a lot of higher non-medical rate costs. One of them is transportation, especially in rural areas where it's difficult to get to an OBGYN. In many cases, people have to travel 50 to 100 miles in rural parts of the heartland. And even it's a challenge for other factors as well. Uh, and this chart shows you some of the racial disparities in undesirable birth outcomes. So across the United States, Black mothers have the worst experience in terms of maternal health outcomes. In Louisiana and Mississippi specifically, 26 and 25% of Black mothers experience adverse outcomes, whether that's um, death or other undesirable outcomes, premature birth resulting in severe learning disabilities. And that's about, among Black women, it's about 10 percentage points higher than the rest of the American population. Um, this shows you, in the case of Arkansas, it's a little bit different, and there's kind of a unique factor at play there. The Marshallese population is very large in certain pockets of Arkansas, and it has the worst maternal health outcomes amongst the Marshallese population. Um, so you have a whole series of factors: low health literacy, behavioral risk factors, smoking, alcohol consumption, and a high body mass index. Obesity is related to some of these poor maternal health outcomes. One of the things we found in a very detailed study was if a woman had 10 or more prenatal care visits during the pregnancy, the risks fall to 1 in 3 from 1 in 5 of a negative outcome. So it gets back to healthcare access and whether you are attached to the system or not. Um, and postpartum care is really important too. You'll see that in many cases, there are many mental challenges. This shows the CDC's top causes of maternal mortality. You can see mental health conditions, a big part of it, hemorrhaging, cardiac, coronary conditions, embolisms, hypertension. And a lot of this relates to high rates of obesity, as I said before. So we need to have more maternal health screenings available, especially in rural areas and underrepresented populations. Um, uh, one of the things we go into in great detail in the study is access to OBGYNs and the poor coverage of many underrepresented populations in the United States that has access to it is a real issue. Um, and here's what's one of the really not surprising, but to the extent that we recognize that the factors here in terms of the cost. So the average medical cost of a healthy full-term birth in the U.S. and in Heartland states is around $6,400. It's a reasonable figure in a vast healthcare system, but those medical costs skyrocket to $238,000 for an extreme preterm birth. So those are hugely vastly different costs, just in terms of the medical costs, let alone uh, the loss of life potentially to mother and child. I'll get into this in a minute. Let me just give you a couple of the figures. I won't go into all the numbers themselves, but just the overall numbers from all this. Both this affects the direct medical costs, the indirect effects, the lost productivity, the loss of human life, so future human capital that could have been developed. And what we find is in the United States overall, and I'll give you a couple Heartland states, it costs the U.S. about $165 billion a year, poor maternal health outcomes. That's just about 1% of GDP. And in the Heartland states, it's about 1.5% of GDP, so about twice as prevalent. And it really does affect economic performance in the center of the country. Um, these are just some of the solutions that we've listed here. You know, healthcare in terms of the workforce, preventative care. We need those prenatal visits and mental health challenges. One of the areas we've been working in is telemedicine, improving access to high-speed internet to deliver some of those screenings without having to drive so far. Health literacy is an important issue amongst much of the population. And transportation, we found, was one of the reasons why, especially a lot of rural women um, weren't visiting their OBGYNs because they would have to take off from work for basically an entire day to be able to go do so. So let me just say that this is a huge issue in the United States and in the Heartland in particular. And we've, as I said, formed the new center, the Maternal and Child Health uh, Center for Policy and Practice, initially launching in Arkansas and a few other Heartland states to try and work with healthcare leaders, governors, and the medical community to address some of these issues because the social determinants of health are manifesting themselves in these just terrible maternal health outcomes. And this is a situation that should not be the case in the wealthiest economy in the world. Thanks.